Right. Hi, everyone. Welcome. My name is Mary Nelson. I'm a policy associate here at the American Public Human Services Association, and I'm pleased to welcome you to today's webinar, Partnering with State Associations to Develop Third-Party Providers, Spotlight on Alabama. For those of you who are unfamiliar with APHSA, we are a membership association representing state and local health and human services agencies through our top level leadership. To learn more about APHSA, please feel free to visit our website at www.aphsa.org. We are excited today to welcome our panelist, Brandon Hardin, the Director of Food Assistance Division at the Alabama Department of Human Resources, Ritahauser, the SNAP Employment and Training Manager at the Alabama Department of Human Resources, Joan Witherspoon Norris, the Executive Director of the Alabama Network of Family Resource Centers, Margaret Morton, the Executive Director of the Sylacauga Alliance for Family Enhancement, and Nick Moore of the Alabama Department. Sorry, my screen just got away from me for a moment. Nick Moore, the Director of the Alabama Governor's Office of Education and Workforce Transformation. Thank you all for taking time out of your busy schedules to be here today. Today, we're going to have an informal conversation with our panelists to talk about how the Alabama Network of Family Resource Centers, an organization of nonprofit agencies and programs that provides a wide array of services designed to protect children and strengthen families in Alabama, mobilized in partnership with the Alabama Department of Human Resources to establish a statewide network of family resource centers providing employment and training services to SNAP and TANF participants. It's an incredible example of how, empowered by legislation and state level funding and leveraging existing relationships and programming, this partnership came together to establish a seamless system of service delivery for employment and training and supportive services in Alabama. So with that, I'm going to go ahead and take down our presentation because we're really just going to have an informal chat today. I'm excited to give these folks a platform to share their experiences. But before we dive in, I want to again thank you all for joining us and give our panelists the opportunity to introduce themselves more fully and their role in SNAP employment and training. So I'll go ahead and turn it over to Brandon since I see him on the box to my left.
Hey, good afternoon, Mary. Thank you again, and thank you to APHSA to be part of this. I'm the Food Assistance Director for the state of Alabama, and underneath me, I have the SNAP Employment and Training program, and I also will be talking a little bit about our TANF work program called Jobs today. And it's great to be with these panelists and excited to talk to you about the Alabama Network of Family Resource Centers.
Rita, do you want to jump in next?
Well, good afternoon, everyone. My name is Ritahauser, and I am the program manager for the Alabama SNAP Employment and Training Program, which is known as ARESET. And ARESET stands for Alabama Resources for Enrichment, Self-Sufficiency, and Employability Training. I am very happy to be here today and look forward to the discussion.
Rita, maybe we can jump over to Joan.
Hi, I'm Joan Witherspoon Norris. It's really good to be with you. I'm the director of the Alabama Network of Family Resource Centers. And thanks to a partnership with the other folks in this group, the Family Resource Centers within our network are all part of workforce development through a SNAP E&T grant.
And I'm Margaret Morton, and I'm the Executive Director of the Safe Family Services Center, a member of the Alabama Network of Family Resource Centers, and a longtime partner with the Department of Human Resources and with the Governor's Office and other entities across the state to create and develop and to implement programs such as SNAP E&T and TANF at the community level. So we're boots on the ground, and we look forward to sharing that story with you today.
Margaret. Oh, go ahead, Nick.
And so I'm Nick Moore, as you said, Governor Ivey's Director of the Governor's Office of Education Workforce Transformation, and glad to be here with a lot of great colleagues that we work very closely with in putting together the Governor's No Wrong Door approach to workforce development and human services.
All right, thank you all for being here again. And for those of you on the line who aren't familiar with Family Resource Centers, Joan and Margaret, could you maybe just share a little bit about what Family Resource Centers are?
Sure. Family Resource Centers really began being established in Alabama in the 1990s. And the partnership with the Department of Human Resources was a big piece in their early establishment, as the Department of Human Resources was focused on providing preventive services to families, services to prevent child abuse and neglect, in addition to the intervention work that they did. And so, so they planted seeds for Family Resource Centers across the state. And each Family Resource Center is its own entity. It's its own nonprofit organization with its own board of directors, its own staff. Every Family Resource Center is driven by community needs and community resources, and therefore they're all really different from each other. So Margaret will tell you about her center, but they're huge. They're our biggest center in the state, and they provide incredibly diverse offerings in terms of programs and services. Some of our centers are tiny with 2 and 3 employees. Our centers are in urban areas, rural areas, suburban areas. They really are across the state. And in spite of all their differences, they do share some really important commonalities. They all take a strengths-based approach to working with families. And we really embrace the Strengthening Families framework, which promotes 5 protective factors that help all families to thrive. So they take a strengths-based approach, and there's a lot of overlap in services and programs too. So all of our centers offer parenting services and parenting programs. Many offer early intervention programs, some home visitation. They all offer case management and have a robust intake and assessment process. And all of our centers really strive to be a place where someone can come in to their doors, and they may be presenting, their thing that may have brought them in might be because of their need help with a utility bill, or their child is involved with in the juvenile justice system and they need support. But what we want to do is wrap our arms around the family, ask them, what are your hopes and dreams? What do you need? And how can we help you leverage your strengths to get you there, and provide the support and case management that it takes for families to get from where they are to where they want to go. And that's why this partnership around SNAP E&T is so important to our Family Resource Centers, because as families come to our centers, the need for increased income, for entering the workforce, for improving their spot in the workforce is what is a really big need from families across the state. Margaret, what have I left out in terms of helping folks understand what a Family Resource Center is?
Well, I think so many times when we look at social services and things of that nature, we forget the important link between that and workforce development. And as we're talking about workforce development, we define that as building human capacity. And if I could say that there is one specific definition of a Family Resource Center, it is building human capacity and building the capacity of a community to respond to the needs of its people, and the ability of a state to do that. And that is the reason that these partnerships that were developed back in the early 1990s has served as the foundation for the expansion and the work that we're doing now with the Department of Human Resources, because they really and truly birthed the Family Resource Center model and have continued to bring everyone to the table to help resolve and to address and build strategies for the future. And so SNAP E&T, SNAP Education and Training, was a logical fit with the Family Resource Centers because we were already doing that workforce development, building human capacity work. And we had the experience, the Family Resource Centers have had the experience of working with the TANF jobs programs. Those are the people that we meet day to day. And so we had the experience of not only the partnerships with DHR, but also the partnerships with other entities like Nick Moore in the governor's office and all the WIOA and workforce development work that's being done across the state of Alabama, which, by the way, is recognized nationally as a leader in this country in terms of building systems of support for individuals and families so that they can move forward in sustainable employment. So it's really been a logical fit, and it's been a partnership again with DHR, with the governor's office, with post-secondary education, with early ed, with prevention. All of those wraparound support opportunities are there at the state level working together, but allowing us at the community level to do the same, which means success.
Thanks so much, Joan and Margaret. That was such a rich description. And you said something earlier that really, I think, reflects that community level. You said boots on the ground. And I just was like, yeah, that's Family Resource Centers. And I'm not sure if, Joan, you may have mentioned this too, but I think it's helpful for our audience members to know that there is a national network of Family Resource Centers, and there are Family Resource Centers in most states. So this is not just an Alabama specific thing. So I just wanted to point that out to you all as well, if you're interested in connecting with your state's network of Family Resource Centers. So I know that this effort with the Alabama Network of Family Resource Centers, which I'm going to refer to as ANFRC, was really built on a foundation of existing relationships, as Margaret just hinted at. And I want to talk more about that in a moment. But before we dive into that, I think it's helpful to start out with just understanding the existing structure of SNAP and TANF employment and training services and what that looks like with ANFRC. And I'm going to kick it to Brandon to kind of start off that part of the conversation.
Thank you, Mary. I first would like to thank Joan on her remarkable leadership with the Alabama Network of Family Resource Centers. I'd also like to thank Margaret Morton and SAFE for their unwavering dedication to serve our communities. These centers are the foundation in which families' lives are touched and moved in the direction of holistic change. For many, many years in Alabama, these Family Resource Centers have helped a multitude of Department of Human Resource programs, including SNAP, TANF, child support, and child welfare. These centers have provided care and guidance to so many vulnerable Alabamians. These centers are the boots on the ground and the connection community that allow our agency to help guide families to the path of self-sufficiency. In the last 5 or so years, the SNAP E&T program has built on the success of our sister program, TANF Jobs, by utilizing the existing partnerships and growing multiple 50-50 partnerships. Those partnerships, of course, started with Margaret and SAFE. Under her leadership, we have grown our relationship with SNAP 50-50 to over 20 Family Resource Centers across the state, many of which serve rural communities and hard to serve communities. Their unique service delivery model allow our clients to build up the skills necessary to overcome barriers and build up that social capital necessary to get locally in-demand jobs. This model allows for the Family Resource Centers to be the voice in the community, voicing our clients' ability to meet local job needs. This model allows for community buy-in, and that is what I'm super proud of. This in turn empowers our SNAP TANF work program, our SNAP and TANF work programs to be a vocal point of community solutions to meet local job needs. Margaret and Joan, if y'all want to build on what you currently offer for our SNAP and E&T and TANF customers.
I can talk a little bit about the structure. Thanks, Brandon. So we have a SNAP E&T grant that is run through Margaret's Family Resource Center, but we actually have some brand new network members, so not actually everybody, but almost every center in our network is part of that grant. And so I think we're getting a little bit ahead of ourselves, but some state funding is really a key portion, a key piece of that. But the grant is run through Margaret's Family Resource Centers, but there's 21 Family Resource Centers that participate in this. And so, so my role at the network has been to help ensure that centers understand how to use the funding, to let them share best practices from one area to another. Every SNAP E&T program is different at the different Family Resource Centers, because it's not a, while the parameters are real and the limitations and the opportunities are similar, how it's implemented at the community level really needs to be community driven. But with that, they're all different, but yet, a lot of the ideas are similar, and it's really nice to, gather the group together and have this idea sharing, and the best practices, like here's what's worked really well for us. Here's, what's brought folks into our center. Here's what's helped us move folks from, forward in their progression. And so the network, at the network level, we bring folks together for that kind of sharing, and also make sure they understand here's how the money can be spent, and here's how it can't be spent, and here's how to report on it so that you can leverage it to the best benefit for your community.
I think one of the unique features of the SNAP E&T, of course, is that you are leveraging money. It's not a reimbursement program, it's a leverage program. So every dollar you spend, you get a return of 50 cents on the dollar, which then becomes state money. And if you're in the world of nonprofit and you're in the world of Family Resource Centers, you know the impact of your ability to braid and blend funding so that you can put all the pieces of the pie together to make the whole, again, as we call dinner on the grounds. So everybody brings what they're good at, but the SNAP E&T serves as sort of that functional part of us being able to fill in the gaps for families that come in. We operate at SAFE and in other Family Resource Centers. Joan mentioned that SAFE is the contractee for the SNAP E&T with the Department of Human Resources. And that's for SNAP E&T. We also receive TANF funding, as well as for the first time ever in the state of Alabama, we have a line item in the budget for the Family Resource Centers, again, thanks to state DHR. And so we're able to take those funds and braid them and leverage off of what we have to provide better services for our families and for our individuals. We can parlay those funds in a variety of ways and utilize them for the education and training, adult education, home visitation, all those programs that are embedded in the Family Resource Center model. Or those participants are eligible if they have a goal of moving forward, if they have an opportunity to express their or identify their hopes, dreams, and ambitions, because this is very much a strengths-based. We're not prescriptive in terms of saying, not the medical model of where you go in and you're diagnosed and then we treat you. That's not the approach here. And that's the reason these SNAP E&T funds are so valuable to us, because they allow us to individualize and make things possible that otherwise, and resources come to the table that otherwise are not there. And again, you're leveraging 50 cents on the dollar. So you've got more money to put, you can expand your scope from year to year through this leverage. And thanks to the Department of Human Resources, we're able to do that in Alabama. And SAFE serves as the fiscal agent for the SNAP E&T with Alabama Network of Family Resource Centers. So you got 3 state level partnerships, and then you've got partnerships with these communities, and our ability to network and work together and solve our own problems at the community level is just priceless.
Oh, that's so exciting. I love hearing you all talk. You get so passionate about your work. And, I have to say too, we've done a lot of research into what makes good SNAP E&T programs. And it's so great to hear many of the things that we're learning through our membership engagement in our projects really just actualized in the Alabama story. So it sounds like you all have built this solid foundation. And I've had a chance to speak with you all a few times before today, and I've come to understand that there were some things that were in place that really helped to develop out the structure that you have today, including some legislation and dedicated state level funding, as well as what you hinted at, Joan, some technical assistance and leadership from ANFRC. And so I just wonder if you all can speak to the levers that were pulled to really make this possible. And I'm going to ask Nick to kick this question off with his perspective from the governor's office and the legislation that was in play.
Yes, so thank you, and want to also say thank you to APHSA for allowing us to join you today, and for everyone that's gone so far and the others from Alabama joining me. So Governor Ivey came into office in April of 2017, and already having been an educator, somebody employed in economic development, and coming from a part of rural Alabama that has a lot of the same needs that the folks here are helping to mitigate, recognize that we did have to put together a system for braiding and blending funding and extending the capacity for the federal programs and the work that we've got going on among local stakeholders. So in that effort, she put together through our state's combined Workforce Innovation Opportunity Act plan, which the Department of Human Resources and under them SNAP and TANF and many other partners that work on human services are part of. And we decided to set the metrics for that 2020 plan. There's 6 key metrics around progress towards serving individuals with barriers to entering education in the workforce. So by actually measuring empirically, where are the people in each of our communities that need to be served, and making the accountability and the performance metrics about how many people we're actually serving, not just how many people who happen to walk in the door we happen to come in contact with. So that change around performance and accountability metrics has had a profound impact on the culture of our public workforce system, because we do a lot more coordination and cross-training, because everybody understands now that there's a certain portion of people that need to be served, and we have to reach that target every year. So the next phase will, of course, be will really be hinged on the gap analysis that we're currently doing to figure out, are all of the programs, education, training, and human service programs helping to prepare people to reach self-sufficiency? And how long will that take? And are the training programs that we have available aligned to our in-demand jobs? And so part of that work has been done in collaboration with the Federal Reserve Bank of Atlanta, who helped us put together a self-sufficiency and benefit cliffs tool. Helps folks like Miss Morton and SAFE and our regional workforce councils and one-stop centers give people a better perspective on what are the education and training services and wraparound and supportive services they need to persist in a training program. And then also it gives more information around career pathways to help make the point that we can't just sit still. And if it's someone that's entering the workforce, they need to have access to progressive wage increases, credentials of value that are connected and stacked together to provide them long-term economic and academic mobility.
Go ahead, Brandon.
Nick, you touched on a lot of great points, and want to thank you and Governor Ivey's leadership on the human capital development, and our Commissioner Nancy Bugner and our Deputy Commissioner Faye Nelson on their approach to making sure that these individuals that need services get services. And I'm sure Joan and Margaret will touch a little bit on the line item in the budget that just came up. So I'll let them talk a little bit more about that. But I want to talk about first the ability of leadership at the top to make sure that this is a forefront of everything that we do at the Department of Human Resources. And that connection to the communities through the Family Resource Centers is something that you cannot measure on any type of performance outcome. That connection there to the community allows those individuals to feel part of that community and be part of that change. And I can't say enough about Governor Ivey and Nick's leadership in trying to get this stuff going for us, and how it's progressing, and our commissioner and our deputy commissioner and the leadership of Joan and Margaret to make sure this works. Rita will talk a little bit about more about what's going on with SNAP E&T in a little while in regards to what actual services and how this has kind of grown. But Joan, if you want to talk, and Margaret, a little bit about the legislation.
I can speak a little bit to that as over the course of the last couple of years, SAFE was the first really SNAP E&T contract, and this was pre-Joan. So I've been around a long time, and this was pre-Joan, and we were working on working with Department of Human Resources by their invitation to come together to see how the Family Resource Centers could work together with SNAP E&T and some other initiatives that we had been working on through some Strengthening Families Through Fathers programs and that sort of thing, so that we could take what was working and parlay that into more opportunities for our families and our children and individuals. And so by coming together, we began with, I think there were 5 sites besides SAFE that were under the SNAP E&T contract with DHR through SAFE. And so, and I have to say, hats off to Ritahauser and her leadership and her ability to bear with us as we all were plowing this field and trying to figure out the landscape, and letting us, you know, it's kind of goes back to the old design thinking process that we're trying to teach children to do, where we can fail, but we can come back together and find new and better ways to make it work. And that's what we've done. And so over the course of the last 3 years, we have expanded this from 5 sites to 21 sites. And last year, for the first time ever, and I alluded to this earlier, the Department of Human Resources and the legislature came together to provide some very specific funding to the Family Resource Centers, to these sites, $75,000. That's a first. And there were 23 sites, Joan, I believe, that were 21 sites that were part of that funding. And so we received the $75,000 with the opportunity to take this state money, it's TANF money, SNAP E&T money, and state money, to take the state money to use to leverage. Remember, we talked about leveraging the SNAP 50 cents on the dollar. So we were able to do that. That is a first. And the value of that, again, is priceless. Because now we have the capability to do more, which in turn we serve more, which in turn we are able to provide better opportunities for sustainable, livable employment for the people that we serve. And so it's been an amazing relationship. And I will have to say that at the heart of this is that we communicate and we value each other. And you hear that in this conversation, in that we, you know, Nick Moore's office isn't out there saying, okay, this is the way you're going to do it, and this is how it's going to be done, and never listen to the people that are out in the field. And the same with DHR. Commissioner Nancy Buckner has been a stalwart supporter of the development of the Family Resource Centers in Alabama. DHR is the birth mother. And so those relationships continue. And because we have those relationships, we are able to do so much more. And we are accountable. We are very accountable for how we utilize this funding and what the outcomes are. You heard Nick mention that in his remarks. We're benchmarking, we are tracking, we are making sure that what we are doing pays off in the long haul for those we serve.
Yeah, and I'll add to that, Margaret, the $75,000 that was designated by the state legislature, and thanks to the leadership of DHR for advocacy, and thanks to Governor Ivey and her team for shepherding that through. But that was, historically, centers have had these strong partnerships with DHR at the state level, at the county level. And so there had been and still there are various other funding avenues, but to have the designated state funding was really, really kind of raised the bar in a lot of ways. And $75,000 across the board to each of the 21 centers, with $25,000 of it designated was TANF dollars, and then the other $50,000 was a portion of that was designated to be used with SNAP E&T. But for all of our centers, that it was not only a big revenue help, but it also helped to focus their programs and help them to have the resources to do what their families needed them to do. So that that line item in the legislative budget was huge. And in terms of benchmarking, we're at an interesting time here. The 12th of October, we've just finished 1 year of receiving this funding, and we're in the midst of gathering reports and tallying up and really getting a firm view of what we've been able to do. But we know that the funding has had a big influence on the families that we serve, but also on our centers themselves and their abilities to respond to families. And at all of our centers, but especially if we're thinking about some of our smaller centers, a $75,000 infusion of revenue has really made a huge difference to them in terms of being able to respond to the needs of the families that they want to serve.
Mary, can I just say one quick thing? I think Margaret touched on a little bit. There's been a lot of work in this. This has not been something that easily came. Building the SNAP 50/50 partnership started several years back, and Rita and her team have been very innovative on trying to meet those service deliveries. But it's come a long way in the fact that we're getting now state and the governor's office recognition on what the importance of SNAP E&T and how we can leverage those dollars. And we couldn't have done it without showing the success in the early phases with Margaret's group at SAFE. So I want to say I'm very appreciative to that relationship at the beginning, and how much work it really was at the beginning of that relationship to try to cultivate. And the good thing about it is TANF and our jobs program had laid that foundation already, and we had a long relationship with the Family Resource Centers prior to that, and other partners too. So we did a lot of traveling around the state trying to build, and still do that, build our SNAP E&T program.
I think another important factor in this, if you don't mind me mentioning it, is the fact that, again, as Brandon said, just those relationships, but the fact that typically when you talk to legislators, or when you talk to the general public about TANF or about SNAP, there is very much has been a very negative perspective on that. And what we have been able to do with the work that we've done with DHR and the work we've done with Nick and the governor's office is to really reframe that message, to be able to say, well, what did we spend SNAP money on? And what does TANF money do? Well, TANF money provides transportation to people who are going to work. You know, it's taking people for training. SNAP provides all these support opportunities. So it really reframes and the focus on these individuals who might be coming from a very different background and perspective than we grew up in, or we may have, and we had that partner and that individual that walked hand in hand with us. That's who the Family Resource Centers are. And that is changing the perspective and the focus on exactly what does TANF and what does SNAP do.
I love it. You all are, you don't need me to ask questions. You're doing such a good job at hitting all of these important parts. And so you've already spoke to this a little bit, but I wonder if maybe we can dig a little deeper. So in the times we've spoken previously, two major themes have come up. The value of leveraging relationships and coalition, and also building around what's already been established. So you don't have to reinvent the wheel. There's already a history here of proven service delivery. And I wonder if you all can speak a little bit more to that. And I want to kick it to Rita to maybe talk a little bit about how you leverage that existing relationship to really build out this network around SNAP E&T.
Well, the wonderful thing is we didn't have to build a blueprint, as Brandon was speaking earlier. The department had already been working with the Family Resource Centers with the TANF and Jobs program. So we looked to the model that was already in place to build on the SNAP Employment and Training Program. We have already had great relationships at the state level with DHR's involvement with the Workforce Board and with the Family Resource Centers and with the TANF and Jobs program. So it was just a logical fit for us to start working with them. They are known statewide for the wonderful services that they provide in the communities. And many of the individuals that are served in SNAP also receive services at the Family Resource Centers. So one great thing about that is when an individual comes into the Family Resource Centers, they don't have to identify themselves as a SNAP or a TANF person. The Family Resource Centers work with them so seamlessly where they feel so comfortable coming in, whereas they may not feel as comfortable coming into a DHR office. So a lot of people that receive services there that may not be on SNAP, then they come in and they apply for the SNAP benefits and become a part of our program. We started with just a few centers, as Margaret spoke about earlier, and we've expanded. With those few centers, we were able to lay a groundwork and establish how the partnership would work. And with that, we were able to show the other Family Resource Centers that were interested, okay, this is how it can work for you. This is how you can leverage the money that you already receive. We break it down as simple as possible. We have a chart and a graph to show to say, hey, if this is how much you're spending on your SNAP participants, then this is what you can be reimbursed. Once you get that money back, then these funds can be reinvested into the SNAP E&T program. You can apply that towards your next monthly bill of services and you receive half of that back. So it has just been really great working with Margaret and Joan and all of the Family Resource Centers. They provide just about every service, I think all of the services that the SNAP Employment and Training Program offers here. A big part of that is the case management. Every individual in this program has to be offered case management, and the Family Resource Centers have been phenomenal in offering that. So we work with some other partners that may not provide this service, and we're able to kick them over to the Family Resource Centers to receive case management, which also allows them to have some of those wraparound services that the other partners may not provide. So they provide the job retention services, which over the years, even at a national level, they see is very important, because once an individual gets a job, it is it is very imperative that we continue to work with them to ensure that they keep that job, that they maintain that job. And through those job retention services, we're also able to encourage them to, hey, you don't have to stop here. You can keep going. We can provide you additional training. The Family Resource Centers provide the vocational training offered through WIOA. So it is truly a no wrong door approach. It is a one-stop shop. So even though they may come in to first receive GED services through the opportunities provided at our Family Resource Centers and the encouragement that they receive, individuals go on and receive different certifications, which allows them to receive better jobs and to become self-sufficient, and also to work on those generational poverty. It is a place where one individual can truly change the course for an entire family. So they not only serve those individuals in the program, but they can offer services to other family members. And I could go on, but I will go ahead and let Nick or Margaret, if you want to jump in.
Nick?
Sure. So I do think that there's no question when we think about the intent of Congress when it comes to SNAP E&T and many of the TANF related programs too. It's not for these to be narrowly tailored and constricted. These should be partnerships that we see proliferate with all manner of partners, community college partners, nonprofits, as a great example with SAFE. And that's something that we've been very intentional about under Mr. Hardin and Commissioner Buckner's leadership of getting more and more of our community colleges and education and training providers to make SNAP E&T an indelible part of the workflow of the supportive services they're providing. And so, for example, in a grant that we received from the U.S.
I'm not sure if, I think Nick, we lost Nick for a minute.
Department of Education around. Sorry about that. I'm hardwired down here, but the broadband expansion still hadn't quite caught up down here in the Capitol. So I'm sorry about that. But what I was saying is that, you know, I like to jokingly refer to SNAP E&T as legal money laundering, because there's no other program to where you can get, you can take what would be federal funding and turn that into state dollars. And so through partnerships with our community college system, we're making a truly diverse system delivery, and a grant that we got from the U.S. Department of Education, one of the Reimagined Workforce Prep grants, we have set up something called the Human Capital Development Fund. Now, we hope to see this become more than a pilot through this grant, and it's something that we will use to extend the individual training accounts or the individual plans for employment for everybody that's part of the public workforce system. And so once we understand what people's needs are for supportive services, we will be able to very prescriptively and empirically say, X amount of dollars for transportation, childcare, housing, or whatever that need is. But having a system of first identifying what those benefit cliffs are that people are facing, which is part of our work with the Federal Reserve, the edifice through which to coordinate all of those activities, which is the governor's Human Capital Committee under the governor and Commissioner Buckner's leadership. That then allows us to engage partners at the local level. But part of that is also identifying all of those partners. And so through some work we did with the Business Education Alliance in Alabama and the Alabama Workforce Council, we put together something called the Community E-Directory, and we also call it the We Can initiatives. Essentially, it's a community asset map and resource audit, because there's a lot of providers that don't have a website. It may be one or two individuals doing something out of their home or through a church, but those often have tremendous impact, and they can sometimes cover services or provide resources that the federal funding can't cover. And so we only go so far. SNAP and TANF, we all know the restrictions on those. And so not understanding where those partners are, we're not even going to be able to connect people in a scalable way. So the best way we can scale local efforts is for the state to be the convener and using technology to be able to match up the need to the available resources. So those are just a few things that we're doing in the human capital world to be able to connect the leadership, the available resources with the need that exists in the community.
One of the points too that I think has been made over the course of this conversation that being boots on the ground, we see every single day, and that is that there is no wrong door. You can come into a family resource center and there may be, and in our case, we've been fortunate over the course of a number of years to be able to leverage additional opportunities for our children and families. And they may come in the form of education dollars. They may come in the form of the fact that the community college provides the adult education program on site with the Family Resource Center. It may come in the form of transportation opportunities through what is now the TANF Jobs program, where people can ride for free to get to you, as well as to get to other trainings and to jobs if you're 200% of poverty and you're TANF eligible. It may come through SNAP E&T. It may come through TANF. It may come through some funding that we've recently received from the Department of Human Resources and through the Children's Trust Fund for some amazing virtual after school and summer school opportunities in workforce development, not just at the high school level, but understanding that those opportunities have to start at the very youngest of ages. So we are building a continuum of opportunities for children and families through the Family Resource Centers because there is no wrong door. You may be a 6-year-old, you may be a 46-year-old, or you may be a 56-year-old, and there is a place for you at the table because we have been able to work together to make sure there aren't gaps, and that's at the community level and at the state level. And everything you've heard from Nick and from Brandon and from Rita and from Joan is just articulation of what is really the synergy that is really going on when we develop these relationships and these partnerships of trust and that are mutually beneficial, and when we have a common vision. And that really is the reason that the Family Resource Centers are so uniquely positioned to respond and to be the go-to, and we are.
I love that. I love that word synergy, Margaret. That's great. There's so much synergy here. I do want to leave a few minutes for audience questions. I already see we have so many audience questions, but I want to ask one final question for each of you. So this is a rapid fire 30-second response question. What is one piece of advice or lesson learned that you would give to state agencies or organizations that are really trying to build a robust provider network for their communities?
I'll start, Mary. Be innovative with your 100% E&T money. Look at your TANF and your TANF work program. We were able to hire, because we were able to innovate, able to hire some E&T experts that allowed us to learn how to leverage the funding, to be able to not supplant any funding, to be able to help our providers with their accounting systems to make sure that we don't have any issues in regards to the money that we're drawing down. So I would just say be very innovative with 100% money and be able to act on that money to be able to kind of help your providers.
I'll jump in next. I think that I think the partnership is key, and it's partnership at the state level, but it's also partnership at the local level. So when we're talking about implementing workforce development, our centers have to have strong partnerships with their community college, with their county DHR office. And those partnerships is what makes it work at every level of this initiative. And I also think one reason that family resource centers are so well suited for this program is because we are more than this. So workforce development is huge to family resource centers, but we also are parenting classes. We're also after school care. And some of our centers have early head start. We're so much more in terms of what brings people into our doors. And so once they're in our doors, then if employment is one of their presenting challenges, which so often it is, we've already have a relationship with them. And so then it's just one step further to help them connect with our employment services.
I agree with Joan in that regard. And you know, sometimes you have some I think it's really important that we bring the community in, you know, like the state brings the community. Well, we need to bring the community, and we need to make sure that we bring even unsuspecting partnerships. You know, we have a pretty amazing relationship with Chick-fil-A. Now, we're in rural Alabama. When we got a Chick-fil-A, it was the greatest thing that could have ever happened to us. We thought we had hit the mother lode. And Chick-fil-A, the manager, the owner of the Chick-fil-A, comes into our programs and teaches, guess what? Customer service. Because what is Chick-fil-A known for? And that's applicable to any person in life, is to be able to give respect and for others, and to value others. And another opportunity we've had through some of these fundings is a pay to learn model. We know that we are working with individuals who have not had an opportunity to be valued. They haven't been successful. They come to us without a history of success, perhaps in school, perhaps in work. And we need to value them in order for them to be able to move forward and to actually examine what are their hopes, dreams, and aspirations. So through funding from state DHR and through some other sources, we are able to provide a pay to learn model where individuals who are training with us are paid $10 an hour. And then the follow-up, as Rita said, ongoing follow-up for a minimum of a year post-employment or post-credentialing to help them onboard and off-board their career pathway as they are moving forward. But unlikely partnerships, you know, the churches are vital to this work. And so I think that's critical. It's not just about the provider organizations, you know, your typical, but getting out there in the community and making sure that everybody has a part of is a part of the solutions.
And I would say that it is key to have employers at the table. Sometimes human services and economic development gets bifurcated, but I think what the last 18 months has told us, probably more than ever before, is having employers at the table, talking with legislators, talking with people who may not always see the work that we do through an economic lens is a valuable tool. And certainly I may be a little bit biased, but it's almost impossible to scale this work at the state level without having the involvement of your governor, or at least a strong cohort of legislative leadership. So can't do it without leadership.
And I have two quick pieces of advice. Listen to each other and be flexible.
Thank you, everyone. That was great. I can't say how excited I am to hear all the information that you've shared. And I know that folks on the line listening have found this valuable, because I already see we have a full list of questions. We're going to try to get to one or two of these questions, and we will also see if there's a way we can answer some of these questions offline. for those of you who are so curious. And I'm just gonna, my colleague is shooting me a list now, so I'm just going to start with what I see first. So how do you explain, and I think this is Margaret, reflecting on your explanation of 50-50 funds as leveraging versus reimbursement, which that was a cool explanation. I've not heard that before, but how do you explain 50-50 funds to contractors? Do you have examples that you express and that are able to show how great leveraging the money is? And it sounds like many folks, it's a challenge to explain the reimbursement model to their contractors.
I would say that that is true, and probably Rita could better answer that than I. However, as we have rolled out 21 sites over the course of the last year, and when you are talking with people who have a financial background and you start talking about leverage, and particularly in the nonprofit world where it's cost reimbursement, it is difficult to explain. You just spend a lot of time showing that what they are submitting in terms of reporting is not a reimbursement document. It is your expenses. And so then once those expenses are reported, then the process of determining that 50, is 50-50. And then that in turn, that leverage coming back to them, it takes some explanation and out of the box thinking, but it happens. And once the process is underway, then people do understand the value of it. And then it's like, I've never had this opportunity before. That's a big sell for these programs, is the ability to do that and then to turn that into more opportunity.
Do you want to jump in and share, from the agency's perspective, how you explain the reimbursement model?
Yes, I will jump in and add a little bit. Brandon spoke a little bit earlier to this as well. We were very fortunate to have 100% money that we were able to use to hire a SNAP E&T consultant, a consultant group, to be able to help explain that process to our potential contractors. They in turn also created some documents for us to use to be able to explain it in the future. So we literally have a graph that we show them to explain how the reimbursement process works, letting them know that they have to have 100% of the funds up front. For those that had an issue, even breaking it down about how much, what percentage should be billed for expenses. We even created an invoice to say, okay, out of your total participants, how many were actually in a reset, and that helped them even further. So we tried to create as many visuals as possible to be able to assist.
Thanks so much, Rita and Margaret. I think that's really a great explanation of how you navigate those conversations. And I see, Abigail asked if you would be willing to share the graph that you referenced. And I know also there was a question a little ways back around I gotta scroll back here to find it. The 6 metrics that the Family Resource Centers use. Are those things maybe we can share after the fact with the audience members?
Well, I mentioned 6 metrics. Those are just the 6 WIOA key performance metrics. There's also 25 standards that I believe the Family Resource Centers use, but I'll defer to Ms. Witherspoon, Norris, and Morton to discuss that.
Sure. The 25 standards are what are don't relate directly to workforce development, but in order for a family resource center to become part of that network, they prove that they meet 25 standards for excellence.
And just as a historical perspective, the 25 standards were created through our work early on in the early and late 1990s, when the family resource centers were first funded through Safe and Stable Families dollars, family preservation, through the Alabama Department of Human Resources. And they brought in consultants to help us develop those standards. And then in 2000, those standards were legislatively mandated. And so we were the first state in the nation to have legislated standards of performance for family resource centers. And so we've been pretty proud of that, and that has stood us in good stead, because those are the benchmarks. It's not just a member organization. It is an organization with common vision and common standards and accountability. And the accountability for SNAP E&T and for TANF, we have all sorts of accountability measures with regards to outcomes for those that we serve.
I know we are right at 5 o'clock Eastern time. I want to thank our panelists for sharing this incredible information. I know there were many questions we didn't get to, so we'll see what we can do about answering them offline. And if there are other questions that you would like to know more about, please feel free to reach out to us at APHSA, and we'll do our best to connect you and find answers. But really, I just want to thank our panelists again. And thank you all for listening and sticking with us through this hour. Have a wonderful rest of your afternoon, and we hope you come back for more webinars.